Today I am going to discuss the topic of Candiduria and Candida UTI. First I am going to describe the epidemiology. General presence of Candida in the body. Candida species are typically found on the perineal area, and it is usually not present in the urine of a healthy individual. Candiduria often represents colonization rather than true infection. So here comes the question of what's the difference between colonization and true infection. I am going to address this difference. First, colonization. Colonization is the presence of the microorganism on or in the body, but the microorganism is not causing any harm to the body, and body is not responding to its presence. While on the other hand, in true infection, the microorganisms multiply and invade the tissues and cause damage, and body response to its presence is in the form of immune attack to eradicate it. And this immune response manifests in the form of fever, pain, redness, or other signs depending on the site of infection. So, what is the prevalence of Candiduria? About 10% of the urine cultures done in hospitalized patients show the presence of Candida species. So, Candida is the third most common organism isolated from the urine in hospitalized patients. What are the risk factors for Candiduria? The major risk factor include older age, female gender, prior use of antibiotic, presence of urinary drainage devices, for example, indwelling catheters, recent surgeries, and diabetes mellitus. ICU patients are particularly prone to the presence of Candiduria with additional risk factors such as mechanical ventilation, parenteral nutrition, prolonged hospital stays before ICU admission. What is the relationship of Candiduria and candidemia? Simply speaking, there is none. How? Actually, Candiduria rarely leads to candidemia. Candiduria is the presence of Candida in the urine, while candidemia is the presence of it in the blood. In cases when a patient is having both candidemia and candiduria, the molecular studies have shown that the strains identified in blood and in urine are totally different. So what does it mean? It means that presence of Candida in urine is not the source of Candida in blood. In other words, the Candida that is causing blood infection is coming from any other source other than the urine. Candida UTI. There are no established diagnostic criteria set for Candida UTI, but clinical observations show that there is higher risk of UTI with Candida in patients with diabetes or urinary tract obstruction. Now I am going to show the difference of colonization and true infection in detail.